Representative ONeill, you have House File 2983. And your motion is to re-refer House File 2983 to the Committee on Ways and Means. So that motion is before us, and there's an author's amendment as well. I take it it's a technical amendment, but I'll let you describe it super quick.
Thank you, Mr. Chair. Yes, the A2 is technical. It was asked on behalf of the BCA to make things flow a little easier. So restricted kits, those are kits that the victim did not give their permission to be tested, would be direct shipped from the hospital directly to the BCA, and law enforcement would not have to pick it up because they don't need to. And so that's just making that clarification that can happen. And I thank you for that.
Very well. Representative ONeill moves adoption of the A2 amendment. All in favor of that motion, please say aye.
Aye.
All same sign. Motion prevails. House File 2983 as amended is before us. Representative ONeill.
Thank you, Mr. Chair. So today is a historic day. I think this is an amazing opportunity for us to stand with victims and survivors of rape. This bill before us will be the first in Minnesota ever to say we are going to test each and every kit that a victim has given their permission to be tested. I have with me today Mincasa, who have been working with me on this bill, and the BCA, who I've worked with very, very closely to craft this so that it actually will work. It can work. It will get justice to victims that are not getting justice now. It will do so many different things. Let me just talk about the first part of it, about mandating testing all rape kits that are unrestricted. And in this room, we know what unrestricted is, but for the members of the public, it means a victim has given her permission to have that kit tested. Why is that important? Not only is it bringing justice to a woman that has had this kit done, but it also allows law enforcement, and there are over 400 different unique law enforcement agencies right here in Minnesota, to connect the dots where they could not connect them now. If that DNA exists and they can load it to CODIS, the national database for DNA, they can see hits all over. So they can see something in Ramsey County, in Clearwater County, in Monoman County, in Hennepin County. They can see hits all over the state of Minnesota. They can also see hits not just related to sexual assault, but you're going to be interested to find out that also home invasions and burglaries are also associated with rape. You will see the same DNA in those cases as well. We could close cases across the state, both in rape cases and in home invasions and burglary cases, if we could load this information into CODIS. So this is historic. This is amazing, and I just am so excited to stand with victim survivors today, and so much so that I need to tell you that since I've introduced this bill, there now are 23 co-authors, both Republican and Democrat, on this bill in the House, and it has full. You can only take 5 in the Senate, so that's their thing, but they have it full in the Senate. And I want to especially thank Representative Moeller, who's been working with me and helping me on this and has collaborated with me. The other parts of the bill. So a restricted kit, a kit that a victim has not given her permission to test, will be centrally stored at the BCA. No more lost kits, no more counting of kits, no more wondering where it is and if it's been destroyed. So those kits will now go directly to the BCA. They'll be logged in and tracked. I have a retention period for 30 months for a restricted kit. So this is one that the victim did not give her permission to. When we were doing a working group in the past, there was an agreement at 18 months, and I felt that wasn't nearly long enough. 30 months would give that victim 2 anniversary dates plus 6 months to make her decision. Does she want to pursue the case? Now, I'm certainly open to holding it longer, but maybe we'll have to talk to the BCA about that side of it. But for right now, we're going to hold it for 30 months and get notice out to them to make sure that they know that that kit will be potentially destroyed if she doesn't convert it to a case. The last part, we're going to do a database to track all of the kits, and it will be accessible to the victim online. So the victim can go in, log in, check to see where her kit is and what activity that is information that she can have available to her. Also, if she has a restricted kit, so a kit that she didn't get permission to test, she can convert that in that database on that online to say, I'm gonna go from a restricted kit to an unrestricted kit and start the process, and that information will get back to law enforcement so that they can also start the case. With that, I'm gonna turn it over to my testifiers who have so graciously come to tell us more. So, should we go to the Mikasa?
We
All
can
right,
start.
usually
We're
right
happy
here.
to
I'm gonna
start.
go to my left to go to Minkasa.
Very well, welcome. Who's gonna go first?
You're gonna hear from both of us.
Wonderful.
I'm Lindsey Bryce. I've testified in front of, well, this is my first time this session in front of this committee, but I've testified in front of this committee a number of times last year. I'm Minkasa's Law and Policy Director. I've worked with and for victims and survivors of gender-based violence since about the mid-90s, and I'm a former prosecutor. But I'll back up. The Minnesota Coalition Against Sexual Assault provides leadership and resources for sexual assault programs and allies across the state in order to prevent sexual violence while promoting a comprehensive socially just response for all victims and survivors. And I just really appreciate all of the time and attention I'm hearing today that you're giving to all of these different bills that really impact the lives of survivors. I sit here before you today as Minkasa continues over a decade worth of work towards comprehensive reform of medical forensic compliance in Minnesota. I've been part of this work in my role, for only about a year and a half. There are a number of people who have worked on this for many, many years at and through Minkasa. And when you're working on medical forensic compliance, you eventually reach the issues related to sexual assault kits. Extensive efforts in 2018, created a right for survivors to access information such as the date their sexual assault kit was sent to the lab, the date the agency received the results, whether there was a DNA profile ever obtained. But that information is really difficult for victim survivors to obtain. I'm sure that you've all seen, there's been so much media around this issue, and that there's some really compelling stories out in the media specifically related to how difficult that information is for folks to obtain. In 2018, in large part due to a lack of consensus around centralized storage, which I'm really excited to hear we've overcome, and we have consensus now today in today, and we could not create a tracking system or a retention period at that point. So Minkasa's priority this session is this bill. Centralized storage and tracking and a statewide consent form are really our primary goal this session. We absolutely support testing all unrestricted kits as well, and we understand it's a budget year. So we understand that there may be some conversation about dollars around that. I would note that the same 2018 legislation that allows survivors to gain information about their kit also requires prosecution and law enforcement to work together and in any determination around any unrestricted kit that is not tested. So anytime there's a decision made to not test a kit, there's a requirement that be documented. Well, right now, that data sits essentially in law enforcement or prosecution files. It's not in a place that we can actually utilize that data in Minnesota. So if Minnesota doesn't choose to go forward and test all unrestricted kits, then we need to make sure we're collecting that data through this tracking system. I was going to stop myself here and explain what a restricted and unrestricted kit was, but you all know that, and you've already explained that, so I'll turn it over to Jude.
Thank you. Mr. Chair, members of the committee, thank you so much for giving me the opportunity to speak with you today. My name is Jude Foster. I have over 25 years of experience in victim advocacy, and I am currently the statewide Medical Forensic Policy Program Coordinator at the Minnesota Coalition Against Sexual Assault and the Sexual Violence Justice Institute. The statewide Medical Forensic Policy Program works on training, technical assistance, and public policy. We also are currently working on the statewide Sexual Assault Kit Initiative, or SAKI project, with our partners at the BCA, the Minnesota Office of Justice Programs, We are currently in Anoka County, so we are working with the Anoka County Sheriff's Office and Attorney's Office, the Alina Sexual Assault Nurse Examiner Program, and Alexandra House, which is a victim services agency. One of the goals of the Saki project is we move from community to community. It's not just about testing those kits. We are really trying to identify the barriers in investigations in the criminal justice system, and to really make sure that we're not repeating those patterns so we don't end up in the same situation that we were in 2015 when the BCA did an inventory of kits across the state. So in preparing this testimony, Lindsey and I had some discussions about technical assistance. What is technical assistance? That is simply when people come to MnCASA and ask for help and guidance around issues. So I provide technical assistance to law enforcement, prosecutors, rural hospitals, sexual assault nurse examiners, and advocates. Most of my technical assistance calls are about general medical forensic response, including sexual assault exams, sexual assault submission to law enforcement, and the criminal justice response. Approximately 10% of my technical assistance since legislation was passed in 2018 are related to a lack of a statewide consent form releasing the kit to law enforcement from the victim survivor, and nearly 10% are related to sexual assault kit storage. We need statewide kit storage for restricted or unreported kits in a centralized location so that kits can be stored for 30 months and not destroyed due to inadequate storage in hospital and law enforcement agencies. I also provide quite a bit of technical assistance to multidisciplinary teams across the state. Many of them are in rural communities, and I'll give you a great example of what multidisciplinary teams are struggling with around sexual assault kit storage. Many law enforcement really view that kit that is restricted as not being evidence because it hasn't been reported to law enforcement yet. Many hospitals do see that kit as evidence or potential evidence. So what ends up happening is both of those disciplines don't see themselves as the appropriate agency to store that kit. So many kits end up being stored in hospitals that have very limited and inadequate storage space. So what happens is many of those restricted kits are being destroyed at 3 and 6 months. This is, in addition to that issue, has eroded many multidisciplinary relationships that took years to build. And if we are fighting each other, we are not working for victim survivors. So legislation passed in 2018 made a commitment to victim survivors to have access to current information about their kit. And as you've seen in the news, there is no mechanism for victim survivors to know the status of their kits. So in conclusion, I just want to share with you that we really believe that centralized kit storage and a statewide tracking system will increase victim survivors' faith in the criminal justice system. It gives us the opportunity to provide transparency and accountability. It can avoid future surprise backlogs, and it can ensure quick and effective auditing.
Mr. Chair, members, just briefly, I want to talk about.
Excuse me, just one moment, sorry, thank you. We're going to only go for 10 more minutes, so if you could keep it brief, because I do want to hear from Director Evans as well. Thank you.
Thank you, absolutely. Just very briefly, I want to talk through why MnCASA supports the testing of all run restricted kits. Obviously, I don't need to emphasize, or I can't overemphasize the powerful message that sends to survivors. It's crucial from that perspective. It's also crucial from a variety of other perspectives. It's crucial. One of the things we hear is it doesn't need to be tested because we know who the alleged offender is. Maybe the only issue in the case is consent. Whether or not consent exists. And as you heard Representative ONeill say, one of the reasons that's important is because it does link up with there are links with other cases. It's also crucial because evidence gathered from those sexual assault kits, when that forensic evidence is actually evaluated, it often corroborates the victim's story or it exonerates a suspect, right? It can do either, but it provides crucial information in that case. Just briefly, federal best practices, you have 2 documents from us in your packets. You have a legislative policy agenda from MnCASA, then you have this document that says sexual assault kits. MnCASA must standardize the processing. I think you received it electronically. Federal best practices calls for the testing of all unrestricted sexual assault kits, and there's a link to that document in the document that you received from us. There's also evidence that indicates that communities save fairly substantial amounts of money by testing all unrestricted kits and having appropriate investigation and prosecution of offenders. There's some links in that information you received also that backs up some of that detail. In conclusion, it's fair to say that victims and the public both expect and deserve thorough investigation and prosecution of criminal sexual conduct cases. When a survivor chooses to engage with the criminal justice system, it's crucial that we support that. Thank you.
Thank you so much. Very true. Director Evans? Go ahead and state your name and begin your testimony.
Thank you, Madam Chair and members. My name is Drew Evans. I am the superintendent at the Minnesota Bureau of Criminal Apprehension, and I'm happy to be in front of you today to offer our support for the great work that's being done here. I want to thank Representative ONeill and Representative Moeller and other members that have signed on to this bill. I think it's an important step forward in terms of building on some of the important work we've been doing. I'd also like to thank the coalitions, MnCASA and Violence Free Minnesota, and all the other advocacy groups that worked very diligently on some of these issues with our law enforcement partners from the Law Enforcement Coalition. This bill really solves some of those tougher issues that builds upon the work that you've passed in the most recent years. And one of those being centralized storage of these restricted kits. As I think you've heard from a number of different people, the practices vary across Minnesota. Law enforcement certainly supports retention of these kits in terms of if they are reported to law enforcement, they want to make sure that the evidence obviously is there in a manner in which we can process the case appropriately and pursue justice in these cases. The challenge becomes is that it hadn't been reported to law enforcement, so there's varying views on how those kits would be stored. And in addition, there's just a capacity issue in terms of doing this. So we're happy to partner in this dynamic or in this respect so that we can store these kits so that they are available should a victim, a survivor come forward and convert that kit and report to law enforcement. The other thing that's been noted here, I think that's really important, we certainly agree that DNA is an extremely powerful tool. And anytime that a kit is going to provide answers in a case, or as was noted, can connect other cases to provide answers and connect law enforcement certainly is going to support that premise. So the more testing that we see in these cases certainly can link other cases. I will tell this committee, since you passed the most recent legislation related to sexual assault kits, restricted and unrestricted, we've seen a significant increase in the number of kits. So law enforcement, working with their prosecutors across Minnesota, has certainly turned in a lot more kits than they did in the past, and they're seeing, they're following that law that all of you passed to get those answers in these cases. In fact, we're currently at 120-day turnaround time and just got for those examination kits, and that's due to the significant increase in the number of kits that's coming into our laboratory, in addition to the work we're doing on the number of kits that we're working, that was noted here on the sexual assault examination kit grants that we're working on across the state. The other piece on this, the tracking kit, I just want to note for this committee as well, we believe that it's very necessary as part of that unrestricted kit storage so that we ensure at the BCA that these kits are tracked in a way that we can then notify law enforcement. We can make sure that we're destroying them appropriately when they come up on the 30 months as outlined in this bill. And also for those unrestricted kits, I certainly believe it builds accountability into our system by providing a lens through both law enforcement, prosecutor, victims, hospitals, and everybody involved in the process so they can see the status of that kit at all times in the process. And so I think there's some really good items here. I, again, appreciate the work that's being done by this committee and others. I think this is a good step forward for Minnesota.
Thank you, Director. We are over our time. We have 2 members with questions, and then Representative ONeill will give you the last word. Representative Moeller.
Thank you, Madam Chair. I just wanted to also thank Representative ONeill for all your hard work on this bill, to Mr. Evans, Superintendent Evans, to Minkasa, and to all of those who are supporting this. I also wanted to acknowledge that there are many survivors in the audience today, and we're really, really thankful that they're here and have been advocating so hard on these issues. I'll just note, too, that many of us are wearing teal today. Teal is in recognition of sexual violence awareness, and so today we're not red, we're not blue, but we're teal. So thank you.
Thank you, Representative Moeller. Representative Lucero.
Thank you, Madam Chair, and thank you, Representative ONeill, for the hard work and all of the groups that have put time into this important legislation. So just a quick question for Director Evans. When I look at this, there's a requirement that your department creates a website for the front-end interface from the public and then a back-end database. In my conversation prior to this bill hearing with one of the advocacy groups, my understanding is that there's already similar technology in other states, so you're not going to be building something from scratch. I just wonder if you can confirm that.
Director Evans.
Madam Chair, Representative Lucero, we think there's some solutions out there that are off the shelf that we would not have to create, correct?
Representative Lucero.
Thank you, Madam Chair. That's fantastic because we've had some recent history with government trying to create websites, and we don't want to recreate that. So that's good. And then just a point for maybe Representative ONeill. I see in in lines 2.23 through 2.25, there is a direction by the Department of Public Safety to build, design, and maintain the database, but the website isn't in that last language. So just might want to add that. So thank you.
Representative ONeill, no more questions, so if you want to go ahead and have the final words.
Thank you. Thank you, Superintendent. I just want to say I think it's time to test all, and I think we need to close the gap and give justice to those that have been waiting a very long time, and to put serial rapists behind bars. It's just time. Thank you.
Thank you, Representative ONeill. We will lay House File 2983 over for possible inclusion.